The Test and Trace program is really the foundational element to allow us to bring back our students, our faculty, and our staff to a safe work environment, and then also maintain that work environment as they continue to fulfill the mission of a major public university. So the Test and Trace is about getting early diagnosis for those who have the virus, and then immediately trying to protect the rest of the community by identifying who they were with, who they were close to, protecting and testing those. We have incredible resources, 16 colleges, a really successful health enterprise. With that comes the testing. We have a diagnostic lab that's been able to scale up testing and innovate. We have a supply chain group who's working with the College of Pharmacy, College of Engineering, Liberal Arts and Science to produce reagents to keep the tests and the community safe. On the tracing and tracking side, we have a School of Public Health. We have EPI, Emerging Pathogens Institute. We have nurses and pharmacists and medical students who are able and willing to help join the workforce.
The University of Florida is blessed to have a world-class academic health center and also healthcare facilities right here on our campus. And this enables us to launch programs like the Test and Trace program that will allow us to test all of our employees before they start working. And then as the students begin to come back for the fall, we'll be reassured that indeed they're going to be as safe as possible as they study and they live here in Gainesville and on our campus.
Test and Trace is really a straightforward concept. The idea is simply that when you can isolate, pinpoint somebody that's been exposed, you are now down the road of trying to limit further exposure. At the end of the day, this is a really organized, tactical way to have clarity.
Test and Trace is a program that allows us to continue to flatten the curve. Part of the way that you flatten the curve is you identify who is a potential carrier, who have they come in contact with, and then try and minimize those other contact points. And we really think it's important as we continue to battle COVID, and it's really important as we try and keep things really flat and try and prevent a second curve.
I want the faculty and students to know that if we detect any little resurgence of COVID-19 in an individual or in a small group, whether it's in a laboratory or a classroom or a dormitory, that we're going to be on this. We want to identify the incidence that is occurring. We want to track down that person's contacts and ensure that it doesn't spread. We need to be prepared to leap into action to make sure that that does not spread among the university community.
So we're working with leaders across campus right now to ask them to identify who should be returned to work as that part of that first phase. Again, doing it thoughtfully and flexibly, really with an eye on what's necessary to re-energize the campus in a more normal fashion. From there, then we use great social distancing practices and we use masks as a way to really protect each other.
What we hope, what we know, what we believe is that medical science will one day negate coronavirus. One day. We just don't know when one day will come. So in the meantime, the University of Florida has very important missions. We have to educate our young people. We have to take care of the healthcare needs of our communities. So we need a way to function as best we can within that environment. That has galvanized our community, our UF community, to find ways that we can move our mission forward and accelerate that, even given all of the challenges that we currently experience with the coronavirus.
We're all in it together, and I think this test and trace process really reflects on our shared commitment to be the very best we can be during very difficult times. I'm really proud to be part of an institution that's taking the situation so seriously and doing it with the incredible expertise that UF Health provides.
One UF has been something we've all believed in. I think we've all heard it, but only now do we understand what it really means. 16 colleges, a health center, a land-grant university, all coming together.
It is a massive campus-wide effort, and I think it's thanks to all of the experts at UF Health, their amazing capacity, the coordination with administrators that we've been able to put together this program. I think it's unprecedented in the history of the University of Florida, maybe unprecedented in the state. I don't think we could have done it without all of the partners pulling together.
Whatever's come our way, we'll work through it. What's already come our way, we've worked through. We will move forward together.
We are a remarkable institution, and if we galvanize ourselves collectively, we can do this. We can really do this.
We are one University of Florida. We've got this, Gators. Let's go.